Welcome to a vital exploration into the intricate world of insulin administration techniques. In this compelling journey, we'll delve into the artistry of managing diabetes with precision and care. From the delicate dance of dosage to the nuanced choreography of injection sites, every detail matters. Join us as we unravel the secrets behind this life-saving procedure, empowering people with the knowledge to navigate their health journey with confidence and grace. Let's embark on this enlightening quest together. Number 1. Dosage accuracy. In insulin administration is critical for effective diabetes management, as it directly impacts blood glucose control and overall health outcomes. This aspect involves determining the correct amount of insulin needed to maintain blood sugar levels within a target range, which varies based on factors such as patient insulin sensitivity, dietary intake, physical activity, and stress levels. Healthcare professionals assess each patient's insulin requirements based on factors such as body weight, insulin sensitivity, glycemic control targets, and medical history. They calculate the initial dosage and adjust it over time through regular monitoring and assessment. Dosage accuracy considers both background and mealtime insulin requirements. Background insulin provides a steady level of insulin throughout the day to control fasting blood glucose levels, while mealtime insulin is administered before meals to manage postprandial glucose spikes. For mealtime insulin dosing, patients often follow an insulin-to-carbohydrate ratio prescribed by their healthcare provider. This ratio determines how much insulin is needed to cover a certain amount of carbohydrates consumed in a meal. Achieving accuracy in this calculation helps maintain postprandial glucose levels within target ranges. In addition to accounting for carbohydrate intake, dosage accuracy involves correction factors to adjust insulin doses based on current blood glucose levels. Correction doses are used to bring high blood sugar levels back into the target range, accounting for factors such as insulin sensitivity and expected glucose-lowering effects. Patients play a crucial role in achieving dosage accuracy by understanding insulin dosing principles, recognizing signs of hypo and hyperglycemia, and adhering to prescribed treatment plans. Education on carbohydrate counting, insulin injection techniques, and self-management skills empowers patients to take control of their diabetes management journey. Number 2. Injection site rotation is a crucial aspect of insulin administration for people with diabetes. It involves systematically varying the locations where insulin injections are administered on the body. This practice is essential to prevent the development of lipodystrophies, also known as fatty tissue changes that can affect insulin absorption, and to ensure consistent absorption rates of insulin. The principle behind injection site rotation lies in optimizing insulin absorption and minimizing the risk of tissue damage. When insulin is injected repeatedly into the same site, it can lead to the formation of lumps or indentations in the subcutaneous tissue. These changes can alter the absorption rate of insulin, potentially resulting in unpredictable blood sugar levels. By rotating injection sites, patients can distribute the insulin more evenly across different areas of subcutaneous tissue. Commonly recommended injection sites include the abdomen, thighs, buttocks, and upper arms. Each of these areas offers a sufficient layer of subcutaneous fat for insulin absorption. The rotation schedule typically involves dividing each injection site into smaller regions and rotating through them systematically. Regularly changing injection sites not only helps prevent fatty tissue changes, but also ensures consistent insulin absorption rates. This is crucial for maintaining stable blood glucose levels throughout the day. When insulin is absorbed consistently, it can better mimic the body's natural insulin secretion, reducing the risk of both high blood sugar and low blood sugar episodes. Moreover, injection site rotation offers psychological benefits to people with diabetes by reducing discomfort or pain associated with repeated injections in the same area. It also promotes adherence to insulin therapy, as patients are less likely to develop aversions to specific injection sites. Overall, injection site rotation is a fundamental practice in diabetes management. By systematically varying injection sites, patient can optimize insulin absorption, prevent tissue damage, and maintain better control over their blood glucose levels, leading to improved overall health and well-being. Number 3. Injection angle and depth. The angle at which insulin is injected determines how deeply it penetrates the skin and reaches the subcutaneous tissue beneath. Generally, insulin injections are administered at a 90-degree angle, perpendicular to the skin surface. This angle allows for optimal delivery of insulin into the fatty layer beneath the skin, facilitating its absorption into the bloodstream. However, for people with reduced subcutaneous fat, such as children or individuals with very lean body composition, a 45-degree angle may be more appropriate. This angle ensures that the insulin is delivered into the subcutaneous tissue rather than into the muscle, which could lead to erratic absorption and unpredictable blood glucose levels. The depth of the injection refers to how far the needle is inserted into the subcutaneous tissue. Most insulin needles are designed to penetrate just below the skin surface into the subcutaneous fat layer. The standard needle length for insulin injections is typically around 4 to 8 millimeters, depending on the individual's body composition and the injection site. For people with thicker layers of subcutaneous fat, longer needles may be necessary to ensure proper insulin delivery. Conversely, shorter needles may be preferable for those with thinner fat layers to avoid inadvertent muscle penetration. Injecting insulin into the subcutaneous fat layer ensures its gradual absorption into the bloodstream, mimicking the body's natural insulin release after meals. This helps maintain stable blood glucose levels throughout the day. Injecting insulin into muscle tissue can lead to rapid absorption and potentially cause low blood sugar. By ensuring the correct angle and depth, insulin is delivered into the fatty layer beneath the skin, reducing the risk of hypoglycemic episodes. Adhering to proper injection technique, including angle and depth, ensures consistent delivery of insulin, which is crucial for achieving glycemic control and preventing complications associated with diabetes. Using the appropriate injection angle and depth not only ensures effective insulin delivery but also enhances patient comfort and compliance with insulin therapy. Minimizing discomfort during injections encourages individuals to adhere to their treatment regimen, leading to better diabetes management outcomes. Paying attention to injection angle and depth is essential for optimizing insulin administration and diabetes management. Number 4. Injection timing and monitoring. Injection timing and monitoring play a critical role in diabetes management, particularly for patients who require insulin therapy. This aspect involves careful planning of when to administer insulin injections in relation to meals, physical activity, and blood glucose levels. Effective injection timing and monitoring require personalized care plans tailored to each patient's lifestyle, dietary habits, activity levels, and insulin sensitivity. Healthcare providers work closely with patients to establish optimal insulin regimens and monitoring routines based on ongoing assessment and feedback. Thank you for joining us on this journey through insulin administration techniques. Remember, precision in dosage, careful injection site rotation, proper angle, and depth are vital for effective management of diabetes. And don't forget the importance of timing your injections and monitoring your blood sugar levels diligently. If you found this information helpful, give us a thumbs up, share it with others, and subscribe for more insightful content on diabetes care. Together, we can empower each other to live healthier lives. Stay tuned for our next video.